Assalamualaikum and a very good day to everyone. We are from Group 9 and today we are going to present on the question 9 about dermatitis in animals and men. So before that, let me briefly introduce my group members. First, myself, Aisara, and then Mitra, uh, Gan, Huisan, Irdina, Arisa, and then Zulhusni. All right. So the first question is name and describe the lesion. So based on this picture, this is epidermal colorates. The lesion usually well circumscribed, well defined, elevated at the edges, erythematous, scaly, and at the wound, they're usually allopathic or hair loss or even fur. So the lesions are very itchy and it can sometimes develop pustules, a fluid-filled bumps that is usually contain blood. So for the second question, the differential diagnosis for this lesion, it can be either dermatophytosis, dermodicosis, or even bacterial polyculitis. So for this case, it is most likely to be dermatophytosis. So for the diagnostic procedure, I will pass the question to Christine.
For the diagnostic procedure, first we can do a direct microscopy, which we plug the hair for trichogram. So we first grab a small amount of hair at the periphery of the wound using a hemostat. Then we put the hair on microscope slide with mineral oil on it, and then we cover with the cover slip. Then we examine under microscope under low power objective. If there is a dermatophytosis, we can examine ectotrichs around the hair shaft, as you can see in the photo here. And then
All right. Good afternoon. So the next diagnostic test that we can use is Wood Slam examination. So under Wood Slam examination, the animal that is affected with dermatophytosis is diagnosed in the dark room. So we use Wood Slam in a dark room, and then if it's positive, it will actually shine up greenish fluorescent at the infected area. So this can be used as a guidance for hair plucking. So hair plucking will be used for trichogram or fungal culture. And basically, Wood Slam examination can also show false positive. Basically, if the animal is being covered with soap or any bacteria or drugs, it can still show fluorescence. And Wood Slam examination can only be tested for Microsporum canis, and it cannot be ruled out if negative. This means that if the animal is, if the animal is tested with Wood Slam and it shows negative result, it can still be positive. So we need to do further tests to confirm it. So that is all for me. I shall pass to the next question.
Okay, so for fungal cultures, for collection, there are two different methods. Firstly is Mackenzie brush method. The second one is skin scraping. So for Mackenzie brush method, what you use is you take a new toothbrush and you brush the hair coat, and then you will have like hair that will come out from that, and with that hair, you use a sterile needle and you tease it from the bristles, and then you scrape the needle onto a culture plate. For skin scraping, you identify any hair which has a broken shaft, and you use a number 20 scalpel blade and you sweep any crust or the hair shaft or any debris and put it into a culture plate. Yes. Next slide, please. Thank you. Okay. So for the cultures, there's two different types. The first one is dermatophytes test medium. So this is like a modified Sebarod's dextrose agar, but it contains cyclohexamines, gentamicin, and chlortetracycline. So these three will inhibit any sort of non-dermatophyte growth, and it also contains phenol rate. So this phenol rate acts as a pH indicator. So the thing is, pathogenic fungi will utilize proteins and then produce metabolites. These metabolites will then cause the pH of the agar to turn alkali, which causes the phenol rate to change from yellow to red. This is very suitable for canine dermatophytosis diagnosis. Next is Severod's dextrose agar. So this is a selective medium. So this is used to isolate the dermatophytes, and the medium itself is acidic, which means it inhibits bacterial growth, but it permits the growth of yeast as well as filamentous fungi. Okay, so once you've put it onto a culture, you have to examine the culture plate every week for 4 weeks. Then you have to do a macroscopic examinations where you look at the size, the color, the texture of the colony. Next, for microscopic examination, you use an acetate tape and you touch the surface of the culture very lightly. Then you put that onto a glass slide and put a drop of lactophenol cotton blue. Then you examine it under 100 times magnification and look for any sort of macroconidia and microconidia, and look at the wall thickness, the textures, the septate number, the shape, and the size. So, like for Microsporum canis, like the image shows, it will form for the macroscopic examination. Like it will have like a fluffy colony. It's very white and coarse, and it has a very distinctive hairy or feathery texture. Yes, yeah, that's all from me. Thank you. I'll pass on to the next presenter.
So the next is PCR. PCR is stand for polymerase chain reaction. So this is the accurate diagnostic tool for the dermatophytosis in small animal practice. And dramatically is faster than traditional fungal culture as it only takes 1 to 3 working days. And also can detect an early infection if the animal shows no signs, clinical signs, or in a carrier animal. So the PCR can detect trichophyton species, trichophyton metagropytes, microsporum species, microsporum canis, and microsporum gypsum. So we proceed to the next slide, which is histopathology. Kan?
For the histopathology part, hematocillin and leucine stain are used in this case. Hematocillin is used to stain the cell nuclei to become blue, whereas leucine stain the cytoplasm to become pink. Alternative stains that can be used is lactophenol cotton blue stain mentioned by Mitra just now. So in the case of dermatophytosis, cellulitis, abscesses, and pseudoepitheliomatous hyperplasias are expected to be seen in the histopath sites. Besides that, spores, hyphae, and neutrophils are usually present in the autokeratotic layer of stratum corneum or hair follicles. And also, variable intercellular epidermal edema can be observed, and this usually indicates dermation. Sometimes the rupture of hair follicle will release some fungal elements into the dermis and induce acute suppurative inflammation that will eventually becomes granulomatous. And lastly, presence of fungus and its metabolic products such as mycotoxins can induce allergic response in those. Yeah, that's
Okay, finally, I'll continue with deep skin scraping. So it is most useful for diagnosing dermatitis, and how you use it is firstly, um, you pinch or squeeze the skin, the part of skin of the animal to express mites from deep follicle. Then we take a blade, cover it with mineral oil. Then in the direction of hair growth, over 1 centimeter square of an area, um, we move along the direction of hair growth until a capillary bleeding can be observed. So in deep skin scraping, more than 1 to 2 mics are considered diagnostic for dermatitis. So I think that's all from our group. Does anyone want to add? I want to add anything?
Nope. I think that's all from us. Thank you.